I would now request Dr. Nasir Iqbal if he can kindly chair this discussion session for economic factors.
Thank you so much for giving me this opportunity to look into this. So before I ask everybody to have their own comments, let's start with some basic discussion on what are the economic implications of this health as well, especially the mental health and also for the women. So the motion rightly explained the underlying factor that it all relates with SDGs and especially poverty, inequality, social exclusion, climate change, education. All these are the key factors that explain the health part of not only the mental health, but also the physical part of the health. So over the last a couple of years, I am also working on this, the social dimension of this health. And I did some initial analysis at the very beginning of a couple of years back about the health disparities across the region. So it is evident that the poor areas, especially interior Sindh, Balochistan, and the KPK, and also the South Punjab, have a high prevalence of the low health, and as compared to the central Punjab and the urban area of the Sindh. So this again linked with the social part as well as the SDGs. So before I leave this, I have a few suggestions to improve this whole discussion, because this is a well-known and a documented phenomenon that these social issues as well as economic issues like poverty, inequality are the key factor in determining the mental health, especially if we look at the COVID situation. When there is a safe employment, the people have less tension, less mental stress, and they are more comfortable. Like if you are employed in a regular sector, you have a regular job in the government sector, you are less worried. But if you have informal employment and you also fall in the lower segment of the society, then it will increase the stress. And you might heard that Fatehana Sahib is there. The government basically advocating the same concept. If we leave these the poor people in this mess, it will create not only the physical health problem, but also the mental stress, and it's very evident. So giving this, it's like the very important to see how different intervention, as one or two suggested by the motion, like the cash intervention as well as the employment intervention, how these interventions channelize the negative consequences of poverty and hunger and also social exclusion in terms of looking into the mental health. And if he's really interested to expand this review, he should have to look into how these efforts mediate the negative consequences or the negative nexus between poverty and hunger and with the mental health. So the mediating effect is very important. And you should also explore other dimensions, like the Zakat has a well-known network throughout the country, and also the NGOs, those are supporting the poor people, they also have a very well network. And also, most importantly, when we are looking into the economic determinant, we should look ahead to the informal social networking of the people. Because Dr. Nasir also knows that the informal sector, especially in the rural area, plays very key role in terms of supporting these people. Those are in danger and in out of in crisis mode. So you should also have one section in these informal sections. So with these few suggestions, I'll stop here. Now that other people can also have, if they have a comment, they can put it on it.
Can I make a comment? Yes. Thank you very much, Dr. Nasir. I think one of the things which I noticed was a lack of research from Pakistan. The last study, which was in Pak Rupees by Mohsen, were published in year 2000. You know, like 20 years ago. That is not something we should be basing our further work and our recommendation and the way forward. I think looking at more recent relevant research of today. And that is something is that probably we do not have enough people working in health economics in general and mental health economics in particular. The other point I wanted to make was, the third sector and the informal. I think probably Pakistan is one of the, highest in the world about per capita contribution to philanthropy and charity. That also somebody needs to work on it and put those costs together and look at that is what our strength is, but maybe how well we can use. The other thing which the earlier was, whatever we are doing, the women at least have a depression rates of up to 47, 45%, at least in some areas. So looking at the huge costs of depression on one side and limited research is how do we try and reduce this academic gap would be hugely important.
Yeah, I think it's a valid point. Like the informal sector, if like a few months back, there was one study. These were comparing on the philanthropic part of this UK with in comparison with Pakistan. So he basically looked at the Pakistani community working in the UK. So this is a very big contribution in informally and formally. So it also linked with the mental health basically is the outcome of some sort of stress. It could be like economic stress, it could be like emotional stress, whatever it is. You people know better than me because I'm the economist, not the health practitioner. But the ultimately the underlying factor would be the economics, in my opinion. Even if it is a physical health, even it's a medical health, mental health, the underlying factor basically is the economic stress. So the motion should look into these dimensions, how these like channelize this whole exercise. The idea is not only looking into the impact, but how they contribute to this whole stuff. Because if we are really looking for some sort of policy solution, then we should have to look into how these concepts basically facilitate this whole process.
Thank you. Do you want to say something? Yes, please.
I think we can learn from outside Pakistan also, because we have got limited research in our own country. So there's been work done, I'm sure, about in the UK about the informal care which is offered by a family mainly to people with severe mental illness, and they have put costs to it and how much they are contributing towards NHS. So I think those kind of work which we can learn. And the other is there's also been work done in Uganda about cash transfers and non-conditional cash transfers. So that kind of work is again we need to look at if we are able to do such studies in Pakistan.
I think there are also literature available on this intimate partner violence, how this cash conditional as well as unconditional cash transfer like have an impact on this IPV. So you can also look into these issues. So that probably will help you in terms of. Recently, I'm conducting a survey on the illegal migrant in various parts of the world, because this covered on the other, though the formal migrant worker has some space to get physical as well as like the health support from the relevant government, but the illegal migrant faces a lot of problem in terms of either to accommodate themselves in the destination country and also to support their people back in Pakistan. So I'm trying to look how this COVID basically have an impact on their economic as well as health part. So once the study is there, I'll be happy to share the finding on the issue.
Thank you, Dr. Nasir.